Hello everyone, welcome back to our Fine Nursing Tutorial YouTube channel. Who all have visited first time on this channel, please do subscribe. We'll discuss the important emergency, OT and skill-based MCQs in this class. We'll see the first question. A nurse is preparing to administer medication through a central line. Which of the following steps is essential to ensure safe and effective administrations? Options are given. Right option is B, that is use the central line's dedicated lumen for medication administration. Next question. A nurse is preparing to perform a blood gas analysis using an arterial line. Which of the following action is most important to ensure accurate result? Options are here. Right option is A, that is flush the arterial line with saline before drawing the sample. Next question. After suctioning a patient, the nurse observes that the patient has a slight cough and is experiencing some discomfort. What is the most appropriate action for the nurse to take? Here are the options. Here right option is B, that is document the patient response and monitor for any further complications. We'll move to the next question. A nurse is preparing to draw blood cultures from a patient suspected of having a bloodstream infection. Which of the following action is crucial to prevent contamination of the blood culture sample? Here are the options given. Right option is B, that is clean the venipuncture site with alcohol and allow it to dry completely. We'll move to the next question. A patient's urine culture results show growth of Escherichia coli with a significant number of colonies. What is the most appropriate action for the nurse to take? Here are the options. Right option is C, that is consult with the healthcare provider for targeted antibiotic therapy based on culture sensitivity. Next question. A nurse is preparing for an intubation procedure and needs to select the appropriate laryngoscope blade. Which of the following actions is most important for the nurse to perform before using the laryngoscope? Options are given. The right option is A, that is check that the laryngoscope bulb is functioning and provides adequate light. We'll move to the next question. A nurse preparing to assess a patient dialysis catheter for a hemodialysis session. Which of the following actions is most important to ensure the catheter is assessed safely? Options are given. Right option is C, use aseptic technique and sterile gloves to access the catheter. We'll move to the next question. A nurse is troubleshooting a laryngoscope that is not providing adequate illumination. Which of the following steps should be taken first? Here the options are. Right option is A, that is replace the blade with a new one. We'll move to the next one. A patient with a dialysis catheter reports feeling a cold sensation and swelling around the catheter site. What is the most appropriate action for the nurse to take? Here the options are given. Right option is C, that is notify the healthcare provider immediately. We'll move to the next question. A nurse is preparing to collect a urine sample for a culture. Which of the following steps is essential to ensure accuracy of the urine culture results? Options are given. Right option is B, that is use a sterile container and collect the urine midstream. We'll move to the next question. A nurse is responsible for collecting blood cultures from a patient with suspected sepsis. How should the nurse handle the collected blood samples to ensure the accuracy of the culture results. Options are here. Right option is B, that is label the blood culture bottles and send them to the lab without delay. Next question. A nurse is preparing to perform suctioning on a patient with a tracheostomy. Which of the following is the most appropriate action to take before beginning the suctioning procedure? Here the options are. Right option is A, that is pre-oxygenate the patient with 100% oxygen for 1 to 2 minutes. We'll move to the next one. A nurse notices that the arterial line waveform on the monitor is damped and appears flat. What is the most appropriate action to take? Here the options. Right option is B. Check the arterial line for a kings or occlusions. Next question. A nurse is monitoring a patient with a central line and notices that the patient's jugular vein is distended. That is the most appropriate action for a nurse to take. Here the options. Right option is D. Check the central line for signs of infection or blockage. Next one. Which of the following increases contamination in the operating room? Here the options. Right option is C. Maintaining air pressure lower than outside hall. We'll move to the next one. What are the zones of the surgical environment except? Options are given. Right option is B. That is patient zone. Next question. All are components of modular operation theater except. Options are here. Right option is D. That is central air conditioning system. Next question. What are the describing factors of an unrestricted zone in the surgical environment? Options are here. Right option is C. Anywhere, straight clothes, pre-operated. Next question. Painting or scrubbing is used to. Options are given. Right option is clean the area. Next one. Randall Baker's sauces mask is used for. Options are here. Right option is pediatric patients. Next question. The three parts of a SSCR. Options are here. That is option is C. Sign in, time out and sign out. Next question. Prophylaxis antibiotic should be given in patient to prevent surgical site infection. What is the recommended time for administration of prophylaxis antibiotics? Options are here. Right option is C. Within last 60 minutes of incision. Next question. In operation theatre, which of the following is responsible for the counting of gauze, mop or needle counts in surgery? Options are here. Right option is C. That is scrub and circulatory nurse. Next question. As per SSC, amount of blood loss in which arrangement of the blood products is not necessary during surgery? Options are here. Right option is B. Less than 500 ml. Please like, share and subscribe to our YouTube channel for more informative content. Thank you for watching.